was really impressed with Dr. Bonati, so that's why I came to Florida. That was probably my life-changing moment right there. It's been 9 years. Before I went to the Bonati Spine Institute, I had neck pain. I was having trouble going side to side when I was driving. It was hard to see to back up. My lower back pain was also a problem when I was crouching down or bending over, so I wasn't doing my exercises as much. I was walking a lot slower. But then after I went to the Bonati Spine Institute, and he was able to give me the surgeries that cleared out the canal so that I was able to move a lot freer and I feel a lot better. I'm able to travel. I can turn right around and almost look right out the back window to back up somewhere when I needed to. To get in and out of the car is much easier now. I'm able to go back to all the exercising. Line dancing is one of my primary things. I do that 3 or 4 times a week. And so now I'm not limited at that. It was a wonderful experience, and I would refer anyone to go to the Bonati Spine Institute to get anything corrected in their back because they do phenomenal work.
It's hard to believe just how far Beth has come. Before the Bonati Spine Institute, she was stuck in pain every day.
I had a couple of car accidents that I didn't go to the hospital for, so I had a whiplash or two. A couple of other things like that happened along the way. My pain was in my lower back, also in my neck area. It just was constant. So, you didn't really get any relief. It just constantly hurt.
Beth tells us how she tried conservative treatments, but none of the doctors, chiropractors, or physical therapists she saw seemed to know how to help her. That all changed when she came to the Bonati Spine Institute.
So I went to a primary doctor. They sent me to physical therapy. So I did physical therapy. Didn't really feel a lot of correction at that point. So I said, well, let's try chiropractor. I did that for a few years as well. Didn't really solve everything. And I found myself getting stiffer and stiffer. So I went back to the primary doctor. They decided, well, if you're in that much pain, maybe there's some kind of medicine we can give you. Well, we were on hydrocodone for a while, and they say, well, that's not really good. Let's try gabapentin. We can get up to 8 pills a day. All right. Well, I went in after 8 pills a day and said, well, it still hurts. Well, you can go up to 12. Boy, it seems like a lot. Well, I did that for a while. Still working full time on my office work and duties and so forth. Still not feeling very good. Limiting my exercise and that sort of thing. I also went to a doctor a few hours away. He said, there's nothing we can really do until you're no longer mobile. Then we can probably do something. I thought, well, that doesn't sound very good at all now, does it? I don't have strength in my hands at that point. So carrying about a gallon of milk sometimes, might fall out of my hands. I didn't want to wait until I was no longer mobile. I've heard of other people having back surgery, and a lot of times they go through the front instead of the back of the neck. Please do not go for fusions. That's definitely going to cause you more pain in the long run.
Not wanting to endure a spine fusion at any level, Beth began researching her alternatives.
I checked a couple of spine institutes. I've heard about this spine institute, and I know a couple of people that actually went there. I'll go talk to the nurse. She's actually one of my friends, and I knew she wouldn't steer me wrong. She would tell me what was right and what was wrong, or where maybe I should send myself. So I did contact Dr. Bonati. I sent my MRI down, and he said, yes, you're definitely a candidate. You should definitely come down here. And we'd like to see you next week.
Beth shares her experience with the exclusive Bonati Spine procedures.
Well, that was a phenomenal experience. You never watch someone working on you the way that he did. He'll ask you, he says, let me know if there's any pain, because that way I'm able to fix what the problem is right there. So he does, he says, and tell me specifically where it hurts. And to watch it on that screen was amazing, to see everything taken care of the way that he did with the tiny instruments that he uses to get in there and take care of those things with such small incisions. I mean, the scarring is so minimal. It's just amazing.
Like many patients at the Bonati Spine Institute, Beth was amazed by how quickly she was able to be up and walking so soon after surgery.
I mean, you get off the table after you've recovered just a few minutes and you're up and walking, and you notice it immediately. It is great. It's been, 9 years now? I'm doing great. I figured there would be a lot more recovery. I really did. This is so much better, and you recover so much quicker. It's amazing.
9 years after her targeted Bonati Spine procedures, Beth is still enjoying her favorite activities pain-free.
I'm back line dancing. I'm line dancing 3 times a week now. And I garden and I do all the things that I wanted to do before. So we travel and do all kinds of things. So yeah, it's been great. I can't say enough about it.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.